wide variety of polymeric biomaterials are components of the various formulations and devices that are routinely used for delivering drugs to the body. This video reviews the current, state-of-the-art drug delivery systems that release drugs in a controlled manner. When a drug is released, the blood plasma level rapidly rises, followed by an exponential decay as the drug is metabolized and/or eliminated from the body. The figure shows drug concentrations above which the drug produces undesirable side effects, below which the drug is not therapeutically effective. The difference between these two levels is known as the therapeutic index. One can administer safe doses at periodic intervals in order to maintain a desired drug concentration level. However, this is inconvenient and patient compliance is often poor. For these reasons, there has been a great interest in developing controlled release formulations and devices that can maintain a desired blood plasma level for long periods of time without reaching a toxic level or dropping below the minimum effective level. These drug delivery systems are often called the zeroth order systems, since they release drug at a constant rate.
Controlled release polymeric systems can be classified according to the mechanism that controls the release of the therapeutic agent. 4 examples of these systems are diffusion controlled, water penetration controlled, chemically controlled, and responsive. The diffusion controlled drug delivery system is used in drug-eluting stents and transdermal patches. Water penetration controlled drug delivery systems are used in osmotic devices. Chemically controlled drug delivery systems are used in biodegradable reservoir systems. Responsive drug delivery systems are used in mechanical pumps and magnetic drug release systems.
There are 2 fundamentally different devices where the rate of drug release is controlled by drug diffusion. These are membrane-controlled devices and monolithic devices. In membrane-controlled reservoir devices, the active agent is contained in a reservoir which is surrounded by a thin polymer membrane. Release to the surrounding environment occurs by diffusion through the rate-controlling membrane. This system is called a reservoir device. In a monolithic device, the therapeutic agent is uniformly dispersed or dissolved in a polymer matrix. Its release is controlled by the diffusion from the matrix.
In this type of delivery device, drug release rate is controlled by the rate of water diffusion into the device. 2 general types of drug delivery systems are in use: osmotic and swelling controlled systems. In an aqueous environment, water is osmotically drawn across the cellulose acetate membrane, and the resultant pressure on the rubber reservoir forces the agent out of the orifice. Because the driving force is osmotic transport of water across the cellulose acetate membrane, rate of release of the agent from the device is independent of the surrounding environment. However, this device works best only with water-soluble drugs that act as the osmotic agent. To be useful with water-insoluble drugs, a different version, known as the push-pull oros, has been developed. In this device, 2 compartments are separated by a flexible partition. The top compartment contains the drug and has a delivery orifice. The bottom push compartment contains a solid osmotic driving agent, such as a water-swelling or dissolving polymer. A semi-permeable membrane surrounds both compartments and regulates water influx into each separately. The push compartment is designed to deliver all of the drug out of the device.
Each of the previously described systems are based on polymers that do not change their chemical structure beyond what occurs during swelling. However, a great deal of attention and research effort is being concentrated on biodegradable polymers. These materials degrade within the body as a result of natural biological processes, eliminating the need to remove a drug delivery system after release of the active agent has been completed. Degradation may take place through bulk hydrolysis, in which the polymer degrades in a fairly uniform manner throughout the matrix. For some degradable polymers, most notably the polyanhydrides and the polyorthoesters, the degradation occurs only at the surface of the polymer, resulting in a release rate that is proportional to the surface area of the drug delivery system. Dr. Robert Langer of the Massachusetts Institute of Technology had this to say.
And new ways of treating blindness, and then the polymers, the slow release, controlled release polymers, they are permitting new treatments for all kinds of cancer and various mental health diseases like schizophrenia, many heart disease, many others. So let me take brain cancer as an example. What we did there is we created a polymer, and it's a very special kind of polymer, plastic, that just dissolves layer by layer, and so it can't dump the drug out. And also, what's good about it is by changing the chemistry, we can actually make the polymer last anywhere from a day to 3 years or any time in between. And what happens now in this treatment is like the neurosurgeon would operate on the patient, because they're going to do that anyhow, and then they take out as much of the tumor as they can. But before they close the patient up, what they do is they put these little wafers in. This is an example of one of the wafers. And usually they put 7 or 8 in right at the site where they operated. And then the idea is the wafer keeps releasing the drug over, say, a month or two. In the meantime, the wafer dissolves completely, so it's not in the brain anymore. And the idea is the wafer will deliver the drug locally right to the tumor, killing it, but also it doesn't get to the rest of the body, where it could cause a lot of side effects. So people are developing advanced delivery systems, and we're working on a lot of these in almost every area of the body. So some are implanted, some are injected, some you can swallow, some are put in as patches, some are taken as aerosols into the lung. So there's all kinds of different ones exist. It's very exciting. Something like now, I think over 100 million people use these different kinds of advanced drug delivery medications around the world. So it's really gotten into a very growing field that affects and improves the life of many people.
Responsive delivery systems were developed to be environmentally sensitive and respond to the presence of specific stimuli. The external stimuli can be temperature, pH, ionic strength, ultrasonic sound, electric current, or others like it. There are 3 ways that smart gel formulations may be stimulated to release bioactive agents. Thermally induced collapse, which is relevant to skin or mucosal drug delivery. pH-induced swelling, which is relevant to oral drug delivery, where the swelling is induced by the increase in pH and going from the gastric to enteric regions. Sol-to-gel formation, which is relevant to injectable or topical formulations of a triblock copolymer solution that are thermally gelled at body temperature. For in vivo uses, the block copolymer is designed to be degradable.
The polymeric drug delivery systems discussed in this video offer a number of advantages over the conventional forms of drug administration. Thus, it is no surprise that many of these devices have seen great commercialization efforts. The success of these efforts show positive signs for the future of biopolymer development.